You respond to a 58-year-old male at home. Family states he has diabetes and is not acting right. He's confused, he's sweaty, his speech is slurred, there's insulin pen on the table. His vital signs are stable, he follows some commands but seems disoriented. So what is it? Is this a stroke? Is this a drug overdose? Or is this a diabetic emergency? And clear. So ideally we make extra space As EMTs, diabetic emergencies are common, treatable, and potentially life-threatening. Recognizing the difference between low blood sugar and high blood sugar can save a life. So what is diabetes? Diabetes is a disorder involving the hormone insulin. Insulin allows glucose, sugar in the blood, to move into the body cells for energy. When insulin doesn't work properly, blood sugar levels become abnormal. There are two major problems we see in the field: hypoglycemia, which is low blood sugar, and hyperglycemia, which is high blood sugar. Both can cause altered mental status. Both can become life-threatening, but they develop differently. Hypoglycemia happens when there is too much insulin or not enough glucose in the bloodstream. This may occur when the patient takes insulin but does not eat, a patient exercises more than usual, a patient takes too much insulin or diabetic medication. Without enough glucose, the brain cannot function properly. The brain depends almost entirely on glucose for energy. This leads to rapid onset symptoms. Hyperglycemia, meaning high blood sugar, happens when there is not enough effective insulin. Glucose builds up in the bloodstream but cannot enter the cells. The body thinks it's starving, so it begins to break down fat for energy. This produces acids called ketones. In severe cases, this leads to diabetic ketoacidosis. This is more common in type 1 diabetes. Hyperosmolar hyperglycemic state, or HHS, is more common in type 2 diabetics. Unlike hypoglycemia, hyperglycemia usually develops more slowly. Some of the signs and symptoms you may see with hypoglycemia is rapid onset. Think cold and clammy, need some candy. Some common signs: altered mental state, confusion or combativeness, sweating, pale cool skin, shakiness, rapid pulse, possible unconsciousness, and possible seizures. Onset is usually sudden. With hyperglycemia, this is gradual onset. Think hot and dry, sugar high. Some common signs: altered mental status, warm dry skin, excessive thirst, frequent urination, fruity breath odor associated with DKA, deep rapid respirations, also known as Kussmaul respirations, and also signs of dehydration. Onset is typically slower, dealing hours to days. So assessments for the EMT always start with scene safety, primary assessment, airway, breathing, circulation. Diabetic emergencies often present as altered mental status, so follow your altered mental status assessment approach. Obtain sample history, ask about diabetes history. Look for insulin, medication bottles, glucose monitors, anything to give you a clue or hint as the patient may be diabetic. Check blood glucose level with a glucometer, if available. If a glucometer is not available and the patient has altered mental status with a history of diabetes, hypoglycemia should be strongly suspected. Hypoglycemia treatment: if the patient has a low blood glucose, is conscious, can swallow, can follow commands, administer oral glucose per protocol. Reassess mental status and blood sugar. If the patient cannot swallow, maintain airway, provide oxygen as needed, prepare for ALS intercept. Hypoglycemia is usually rapidly reversible with glucose. Treatment for hyperglycemia: there is no EMT level medication to lower blood sugar in the field. Treatment should focus on airway support, oxygen if indicated, monitoring vital signs, treatment for shock, and rapid transport. Some key differences between hypoglycemia and hyperglycemia: rapid onset versus gradual onset, cool clammy skin versus warm dry skin. Sweaty versus dehydrated. May improve with glucose with hypoglycemia, and hyperglycemia may require hospital care. When unsure, check a blood glucose level. So in closing, diabetic emergencies are common and treatable. As EMTs, your job is to recognize occipital mental status, identify possible glucose imbalance, check blood sugar, treat hypoglycemia immediately, support and transport hyperglycemia, and always remember, the brain needs glucose to survive. Fast recognition saves lives.